Hello, my name is Rachel Haynes, and this week we're supposed to do a descriptive speech. And I would like to just talk to you for a few moments regarding an issue I've been noticing I've been having here lately at my job. I don't know how many of y'all are in the medical profession in the class, but I'm actually a nurse on the med-surg floor. And did you know that in the state of Georgia, there is a law that says that I can actually have up to 7 patients at any given time? And I know a lot of y'all are thinking, oh, 7 patients, that's not so bad. But there are lots of things that go on behind the scene that most people don't even realize is taking place. It's my responsibility to make sure meds are given out on time. And I'm also sometimes on the phone with the pharmacy trying to decide why a medication can't be given at this time, why maybe the dosage needs to be changed, or I might even be on the phone with the doctor trying to get a verbal order about a specific test or maybe a different kind of medication. I could also be helping do respiratory treatments, the breathing treatments. And I'm also fielding questions from family members as far as like, what does this test mean and what does that test mean and why are they taking them to do that kind of a thing. I'm also in charge of making sure wound dressings get changed as well. And these are not like your typical just slap a band-aid on it kind of wounds. These are wounds that have specific instructions and specific guidelines on what to do to ensure the patient's safety and that we're taking care of them correctly. Instead of having a system of quantity, I think it should be about acuity. And what I mean by this is when a nurse has a patient who's seriously sick, she should not have 7 patients. She should have maybe 4. And just to give you an example of this, sometimes patients have insulin drips. Patients on insulin drips need to be monitored very, very closely. They can be kind of dangerous at times. And so the nurse really needs to stay on top of how their patient's behaving, what their signs and symptoms are, and things like that. And it's very hard for her to do this if she has 6 other patients that are demanding her time. So I think that maybe instead of having a system based on the number she has, it should be based on how sick are her patients. And the reason why I'm telling all y'all this is that maybe the next time you or your loved one are in the hospital and y'all ring the call line, and maybe it takes just a few extra seconds for the nurse to get there. Hopefully y'all will understand that maybe, just maybe, she has 5 or 6 or even 7 other patients calling for her. Thank you.